I really appreciate it. Thank you. Well, I want to say first, thank you so much for the invitation. It's true. Does microphone also work? Well, I'll use this microphone. It's here. So, my dad and my mom, I'm so proud that they're here. Dr. Shen has put together a wonderful, wonderful event. So thank you, everybody, for this terrific day. And Dr. Shen is very humble, but he has had a big influence on our family and all of us. I think I'm waiting for a clicker to show up. So when my dad and my mom came from Taida and they moved to America, 他那时候说我是美国出生的 ABC， 所以我讲的普通话还可以。但是他们搬过来的时候，他们本来是搬到纽约 ，and I think you correct me if I'm wrong. So Uncle Shen said, no, you don't live in New York. New York's terrible. Live in New Jersey. So he said, you know, I was born in a very famous town called Hackettstown. I'll show you where it is in a moment. You've never heard of it. But there, my dad was the town doctor and built an amazing community. And so we've been influenced with Dr. Shen for many, many years. And then when he said, you should move to California, it only took us 15 years to do it, but we eventually got here. So I'm very happy with that. So maybe we'll proceed to the next slide if you don't mind. Thank you. So the title for you is, and I appreciate Dr. Shen's introduction because the urologist is the doctor that you never knew about until you need them, and then will be your best friend. He's fixing it right now, but no problem. And so the discussion here is about the best friends you never knew you had. So I did grow up in New Jersey, and most people think about you just fly through Newark and that's all you know, and you just know it's next to New York. But New Jersey is a beautiful state. It was a wonderful place to grow up. We had great schools, we had tomatoes, we had corn, we had whole meals of corn. It was wonderful. And 你可能你想到我爸妈妈齐景华跟庄宝书 that might be who you remember, but they are sitting here, they have a little less hair and a little bit more gray, but time changes, it happens. And that's me and my sister and my mom's parents who came to help us make sure we got settled in New Jersey when we were kids. Next slide, please. And one of the things that I think, and I've already heard about many of the children, your children in this room who've gone to the Harvards and the Stanfords and the MITs and all the amazing places. You know, like you all, I think that you imparted the idea that family and education is the most important thing in life. So I've benefited from that, from this community, and from all of the culture that you've passed on. I wish I'd paid more attention in Chinese school. But aside from that, so I did go to Stanford and then UCSF, and those are my kids there and my wonderful wife, Judith, who came to accompany us today. Thank you. And next slide, please. And then the other thing I might say is just a brief introduction to end. I think maybe one slide back, please. One slide up. Am I missing a slide there? That's too bad. Okay. I had one picture. I was very honored when Dr. Shen and Mrs. Shen came to my wedding. This is almost 16 years ago now. And we had a lovely time, and there's a picture of him sitting with my dad. I'm so sorry it's not coming up on the slides today. And that was a great moment because it's amazing to me to look out here and see this community so many years later coming together, tied together from tie-dye. I mean, that's an amazing marker for who this community is. And having those friendships over life that have really changed each other is really remarkable. So thank you for that. Next slide, please. So now let's get into it. So my goal here is to, when Dr. Shen said, please talk about bladders in the elderly, and I said, oh my God, I'm going to scare everybody. I figured everybody's going to think, okay, when they see that title, I'm like the ghost that you fear at nighttime, hanging over all of your heads. But next slide, please. But I assure you, that's not what incontinence and bladder issues and prostate issues are about. So my goal here in this next minutes is to talk about one. I feel fortunate. It's a great field because a lot of what we do is quality of life. And as you approach the years that you're living now, quality of life is the most important thing, among many things. It's very important. And so a lot of the stuff we're going to talk about has to do with quality of life. We'll spend some time demystifying what we're talking about, so demystifying the bladder. I know I hear there's a lot of doctors in this room, but we will talk a little bit about like what the bladder's about, and then diagnosing the bladder, and then give you a little update on what's kind of the newest and greatest things in this space. And then the very last thing I'll talk about is building bridges, because I think that this community is a wonderful opportunity. Next slide, please. So when we talk about, oh, I got them in reverse order, so there we are. Dr. Shen all my life has been giving me advice, and actually I would have gone somewhere else probably for both undergraduate and then for medical school, and I called him and I called Wen Shen, and I know Wen's speaking tonight, and both of them were saying, what are you, crazy? This is the best medical school in the world. So the decision was made for me, so you've had a big influence on my life. So quality of life is the first thing we'll talk about. Quality of life is something, it's like good art, like you just know it when you see it, right? But everybody knows, do I have a good quality of life? I bet everybody in this room can think of something about their quality of life that is very good, whether it's spending time with family. When my parents moved to California, it was the middle of the pandemic in 2020, and they were scared to move, and so we made them drive and we booked them hotels just to go use their own bathroom and then keep going. And then they get here and they've created a very beautiful community for our family. So mom still cooks every Saturday and has all the grandkids over. And those are the things that I think people do here, so thank you. And you know, Dad, I think these are moments of great quality life. So if you didn't know, 如果你不晓得的话，他很会煮饺子。That's where he learned from Sandong, right? So that's him, that's his job when we get together, 我们做那个饺子, so he mans that pot like crazy. And so, you know, making them and spending time together, that's quality life. Next slide, please. And, you know, doing the activities that you love in your life. So we've enjoyed the Bay Area very much. So we've gone biking, we've gone camping and fishing, we've eaten lobster. Actually, if you know, this place is just 5 minutes from here. There's a lobster place just down the street. So if you want lobster fresh, you can get a lobster roll here this weekend if you'd like, if you're visiting from out of town. So, you know, that's quality life, doing the activities that you really enjoy in life. Next slide, please. Now, when it comes to figuring out if your quality life is not as good as it should be, sometimes that's harder to recognize. And I get this question from my patients all the time. Well, you know, I'm getting older, and, you know, I wake up 2, 3, 6 times at nighttime, but, you know, that's just part of getting older. And you have to wonder to yourself, okay, is that normal, or is that a bad quality of life? And I think many people just think about that as part of the aging process. I just know I'm going to have to get up 2 or 3 times. I'm going to have to run to the bathroom, and, you know, maybe I wear a pad for incontinence, and that's just kind of part of who I am. But I'm not necessarily sure if that reflects the best quality of life that you could have when it comes to your bladder and your prostate and your urination. Next slide, please. So we oftentimes will even build our lives around these things related to our bladder because we think that that's just normal. So this is me, that's not actually me because I have less hair, but this is me when I fly. I mean, I do a lot of travel for work and all sorts of stuff. I only reserve the aisle seat. You know what I'm talking about, right? Because I only reserve the aisle seat because if I got to get up and go to the bathroom, I don't want to bother other people. So that's me, even if the whole plane's empty, I'm going to sit in the aisle seat. And there are apps now, so if you go on a drive, that will help you map out where all the bathrooms are. So I have patients who said to me, Tom, when I go from San Francisco to visit you and I got to go home and I have to drive to Stockton, which is 4 hours away, I know all the bathrooms. And I just know I'm going to stop there. So thank you for seeing me today. And that is building our lives around quality of life. And you don't look too far. If you go back one slide, this is an actual product made in Oregon, made in the USA. Purple Rain Adventure skirts for men and women, where you can just hike and then stop and pee. And they encourage women to pee standing up. So we are building our lives around quality of life when it comes to our bladders. But I don't think it has to be that way. Next slide, please. So when you actually look at the data, this is a very nice recent review that came out for the European Urology, where they're thinking about, okay, if you just think in your lives, how many people here get up at nighttime to go pee? I do. Okay, you don't have to raise your hand, but probably some. And if you look at that, just people who have mild insomnia, meaning you get up maybe once at nighttime, versus severe insomnia, you get up more than twice at night, you have increased depression, increased dysrhythmia, your heart doesn't do well, you may live less long, all sorts of bad stuff. So your quality of life also affects your physical quality as well, and that's where urination and bladders play a role. And this graph is just to say that as you get older, not surprisingly, we've probably all experienced this personally, you will probably get up more at nighttime. So you need to think about managing these issues more actively. Next slide, please. And so let's move to that first phase of let's talk about demystifying the bladder, because a lot of people don't think about this. I, of course, think about this every day like an obsession, but Even though there are many people here who've been around medicine for a long time, thank you so much. Okay, we'll give it a try. Thank you, it's working. So the bladder, I know there are physicians in here, so I'm going to start from the basics, so there may not be some physicians in here. It's in the pelvis, right? That's a basic thing. And so when you think about the bladder, people standing, kidneys here, ureters here, the bladder here, and the urethra, and that's what people produce. What you make and what you experience may not actually reflect what your bladder is doing. That's a very important concept, because all we see is the pee that comes out at the end. But what your bladder's doing may not actually reflect what you're experiencing. Whether you're a man or a woman, it's all the same. When we as urologists invite you very kindly to come visit us in the office so that we can torture you, usually the first thing that we do is what's called a cystoscopy. There's a beautiful talk by Dr. Huang about scopes, and Dr. Shen and many in this room are probably using scopes on a daily basis. It's one of our primary tools. And so I actually brought a scope. Well, maybe I'll say it this way. So as I lift this up and show this to you, who gets their blood pressure raised a little bit? Who's feeling a little bit like, oh gosh, don't come near me, right? Because this is what we put inside of your body when you come upon our invitation to our offices. And so you're welcome to come up and take a look and demystify that, because it's not that scary. But we use it as a major diagnostic to figure out what's going on with your bladder, because we know the way you pee and the way you experience your pee may not reflect what your bladder's actually doing. And what we're looking for is, for example, here, this is a man, so that's the prostate. We're coming up through the urethra into the bladder. This is actually a pretty good-looking bladder. So inside the bladder, you have this pink wall. It's very smooth. That's kind of healthy-looking tissue. But we do see, in this guy, there's some stuff floating around. It means they're probably not emptying their bladder very well. So we're looking for those signs to say, is this bladder treating this person well in their life or not? And that's actually a pretty good-looking bladder, as opposed to, now this bladder I'm going to show you, I go in with the telescope, and you can see right away it's different. As we zoom out, there's all these ridges back there, and it looks like lumpy and bumpy. And we say to ourselves, oh, this is a bladder that looks tired out. Those are what's called trabeculations. And so those are signs that say to us, well, maybe even though this person feels like they're peeing pretty well, their bladder may not be in very good shape. So that's why we have these torture devices that we put inside of you to take a look. So that's kind of the mystery of the bladder and the prostate. I mean, it's not much magic to it, but I feel like a lot of times patients come and they say, well, why are you doing this? Like, I pee fine, I'm fine. Because we're thinking about, okay, even though you pee and you might experience pee okay, what is it actually doing on the inside? So how do you know if you're actually in good shape or not? That's kind of the next question I think it's important to think about. So it might surprise you, but on average, people pee 6 times a day. So if you say to yourself, man, I am peeing every 3 hours and it's driving me crazy, that's pretty good. Now, if you're peeing 12 times a day, maybe that's a little bit more than average. Waking up at nighttime, on average, most people would say, no, I don't wake up. Do I have urgency? Am I running to the bathroom very quickly? Do I have to go a lot during the day or nighttime? Usually not. That should be average, or I don't say normal, because there's a lot of normals. This hair is normal for me, but it's probably not average. So this is what's average. And then if you're a woman and you have a urinary infection maybe once, maybe twice a year, as a urologist, we say that's probably average. It's not terribly worrisome. If you're a man and you have any urinary tract infection at all, that's worrisome, and we should probably take a look at that. So those are the types of questions we ask. I have a little picture of a fire hose, because when you think about how fast does my pee come out, it should come out fast. You shouldn't have to wait at whatever toilet you're standing or sitting at, or if you're standing with a skirt, if you're standing in the forest, you shouldn't have to wait very long. And then incontinence, on average, most people should not have incontinence. So those are the questions that we think about as we see patients in the urologist's office. And I'm showing you on average, so this is an ultrasound picture. And on an ultrasound, the bladder is this big black thing, so it's filled with fluid. This is urine on an ultrasound, it's big and black. And the wall of the bladder is nice and smooth, and it expands. It's just a bag of muscle that expands and contracts. So that's kind of average and normal. So how do I know if I'm not average or not normal? So it's no longer working now. There it is. So here's what a bad bladder might look like. So if you get an ultrasound and your radiologist is like, well, you should go see a urologist. So you can see here now, here's the bladder again, but now the wall has all these bumps. And before I showed you the cystoscope video, that's what the trabeculations look like on an ultrasound. So if you see your ultrasound and you think, oh, that's kind of a lumpy, bumpy wall, maybe that's not average. Sometimes it gets very thick. So if your bladder, which is muscle, is working really hard to squeeze the urine out, then it might get very thickened, and that can be a challenge. And so you might see something like this. Or if you're a man, here's your bladder again. Now here's that prostate. So you can see the prostate is encroaching on the space of the bladder. So every time you go pee, the prostate just gets in the way like a ball valve. So those are things that might not be perfect for you. And then, next slide, please. We can also look at this from other different types of views, like a CT scan. This oftentimes will come up. I went to go get a CT scan for my back, and I found that my bladder was very large. What does that mean? So what I'm showing you here is a very, very large bladder. So if you can think about, this is your tailbone here. This is way above the belly button, the umbilicus. Your bladder should be way below that. So if you are feeling down, you're like, oh, I can feel something down here, and then your doctor says, oh, you have a really big bladder, that's a problem. And this person has a very large prostate here, and that's probably why. Next slide, please. Or sometimes if it gets really bad, what I'm showing you here is a bladder, and it's got this outpouching here called a diverticulum. Your bladder has worked so hard over time that it's made another pouch. And so that's going to be a problem for urinary tract infections. Or it's made a pouch out like this, and those are what we think about as, oh, these bladders are in trouble. So even though you might say to the doctor, I'm peeing okay, if we see things like this, it makes us a little bit worried. Next slide, please. So ultimately, our goal is to prevent things like this. And while these folks may look very happy and comfortable, you can see they're wearing diapers. And so let's not get to that phase in our lives. And this person is an X-ray here, but what this is a catheter. So a patient's wearing a catheter. So thinking about how to protect your bladder and keep it healthy over the course of your life is an important concept to keep us away from these types of problems in the long term. Next slide, please. So now this is the part of the talk for the next maybe 7 or 8 minutes or so. It'll get a little bit more about, okay, what's out there, what kind of treatments are there, and a little bit more complex, not complex, but a little more technical, more to get you an idea of what's out there, what's the latest and greatest, and also, if you're in to see a urologist, what should you be asking about? Next slide, please. So one thing I would say for men and women, probably most women have heard of Kegel exercises or pelvic floor physical therapy, and most men have seen that and laughed at it and said, not me. I would present to you that pelvic floor exercises are great for men and women, and it's one of the unsung heroes. If you're having urinary symptoms and your doctor comes in, you say, okay, you should have surgery right away, take a pause and think, have I really exercised these muscles to maximum first? Because it can really help both men and women. I searched long and hard to find what I think may be a man actually doing the exercises, because most men kind of dismiss this, but it's great for men and women to improve your pelvic health and your bladder health. Next slide, please. So I'll spend a little bit of time on men to talk about what the latest and greatest are out there. I'll apologize in advance because my specialty is actually enlarged prostates and kidney stones, so I got a little more depth on the men's section, and so I don't want the women to feel like I'm short-shrifting you, but you're fewer slides, so I'll apologize in advance. Next slide, please. So when you go into the doctor's office or the urologist's office, we're asking you not just the questions about what you're experiencing, but we're also doing a lot of testing. So we're looking at your prostate size. If they ever tell you, please come in the office with a full bladder, it's because we want you to pee into the bucket so we can see how fast things are, mostly so we can understand what's your baseline and where are you going over time. Now, I won't ask this question out loud, but men may recognize that at some point you might get a transrectal ultrasound to take a look at the prostate, and that's what that looks like. And we're looking for things like cancer, we're looking for size of the prostate, we're trying to understand, okay, what's going on as far as the health of your bladder is concerned. Next slide, please. And if somebody says to you, oh, that's great, you should have surgery for your prostate, there's a lot of medications in 2024 that we use to treat prostates nowadays for men. They fall in these 5 categories, so they're muscle relaxants for the bladder, for the prostate, and then there are erection medications that we use for urination nowadays, and I'll walk us through that very quickly. Next slide, please. So many big studies years ago, this is one famous one, that just say that if we give you more than one medication as a man to treat your urination, you will do better than having just one medication. So if your doctor says, well, you know, you've had one medication, maybe able to refer you to the urologist, you could do 2 or even 3 of these medications, and that's perfectly safe. Next slide, please. And bladder relaxants are one. So if you're a person who goes to the bathroom with great frequency or urgency, sometimes we give you medicine to relax your bladder. And what they do is they simply allow you to not have to go to the bathroom quite so often, or maybe not get up at nighttime to go to the bathroom. And these drugs have been around for decades, for 40 years or so. Next slide, please. And more recently, if you know what tadalafil is, the trade name is Cialis. So that was created as an erection medication. So people use it to increase their erections. And about 8 years ago now, there was a big study that came out in a VA population that said that if you take Cialis, a small dose every day, it can help your erections, but also it improves your urination. So nowadays, you should be offered at least 3, if not 4 medications before you're pushed on to do a surgery or a procedure, in my mind. I think that's the right thing to do now. Next slide, please. And so I'd say some things that do come up. A lot of times people will get started on these medications, terazosin, doxazosin, which are older medications at a very baby dose, and not go up on them. And so if you're on a baby dose, or you recognize you're on a baby dose, ask for an up titration, because that can help. As I mentioned, combination therapy is better than one medication at a time. So if you're only on one medication, ask for multiple. And then think about, of course, that tadalafil. You know, I also won't ask people who's got erection problems, because that's a rude question for a urologist. But it's a nice 2-for-1. So tadalafil nowadays in 2024 is a great option. The biggest downside is that sometimes insurance coverage can be a challenge, so you got to work with your doctor's office to get a pre-authorization. But these are kind of some strategies that work nowadays when we think about medications and how to enhance our ability to use them effectively. Next slide, please. Now, I'll talk a little about the surgeries, because also in 2024, I love Dr. Huang's comments around Y Combinator. A lot of this technology actually spun out of Stanford and the incubators they have there. So in general, this is the prostate here. Here's the bottom of the bladder. The prostate sits right below. And if you're getting a prostate surgery for cancer, we take all of this out. But if you're getting it because you have your urination issue, we're just doing something with the middle part of the prostate. That's called the transition zone, because the nerves and the blood vessels sit out there. And so if we take the whole prostate out, your risk of having erection and urination incontinence problems increases quite a bit. Next slide, please. So what do we do nowadays? If you remember back to when you were training at TIDA, I'll bet who here has seen or participated in a transurethral resection of the prostate, a TURP surgery? I don't know if you remember. Yes, okay. So we got a few hands in the air. Now, probably when you were training, they took one of these scopes and they put it inside and they put their eyeball to it and they were moving like this the whole time and their backs came out like this. It's terrible. So nowadays, we have videos and different cameras and things like that, but TURPs are still done. It is the most commonly done procedure in the United States. But my take home here is that that technology is 150 years old. So if your doctor is only offering you a TURP as the only surgical alternative, please find a second opinion. Because there's different types of lasers nowadays. There's also, I mean, open surgeries kind of come back with the robot now. So there's many different options. Next slide, please. And I'm listing this. You can take a picture of this slide so that if this ever comes your way, you at least have a way to think about how to kind of move your way through these things. But you should ask for multiple options. So if your doctor says, we're going to do a TURP on you and you're going to do great, it's probably because they don't know what these other options are, because the field has changed quite a lot. My particular specialty is laser enucleation because it's a hard surgery to do, and I guess I like hard things. But there's lots of different options. Next slide, please. And I'm just going to kind of buzz through these things. Next slide. Why don't we just keep going? Next slide, please. Next slide. And next slide. And next slide. Okay. So those slides were just a little more detail about each of those procedures. The only major thing to take home is that just remember there is more than one option. So if your urologist or your doctor only offers you one option, ask for more. I'll tell you a little about kind of the latest and greatest, because I think a lot of people have thought about this. So the TURPs that I was just showing you, where you're kind of in there scraping prostate tissue out, is kind of like an orange. So if you think about your prostate, like the picture I just showed you, there's an outer part of the prostate and the inner meat, like an orange. So In a TURP, a transurethral resection, what we're used to do is just scrape the inside out, and then we have all this scraped out stuff, and that's it. In a HoLEP nowadays, we use lasers to cleanly get rid of that middle part. And so that's kind of a technology that's out there, or if you're thinking about surgery for a prostate and nobody offers you this, the reason is that it's a very hard surgery to do. So if you live in the Bay Area, for example, UCSF is good, UC Davis is good. I wouldn't go to Stanford, sorry if anybody's from Stanford. But you have to know where the surgeons are who are doing hundreds of these in a year. Otherwise, you should find somebody else. Next slide, please. And so the reason why this is a good surgery nowadays is that it gets the most amount of tissue out. So I'm showing you a video of the bladder. I'm inside the prostate now. That clear thing is the laser. And so we're using it, if you can imagine, it's a very big screen. So now we have big video cameras and all, but we're working inside the urethra. So we're not cutting the skin, so it's a very small space. So we're using the laser now to cut through the tissue and to get rid of that middle part of the prostate. So if you can just imagine, okay, I've stuck this like tiny laser inside of the penis, inside of the prostate, and I'm cutting a whole area out. It's a very small space, so it's hard to do, which is why not a lot of people are doing it. So, but that exists. Next slide, please. And then when you're done, now I'm showing you a cystoscopy for after surgery where here is where the prostate used to be, and here's the telescope coming in, and we're looking back on ourselves. Here's where the prostate used to be. You can see we take out a whole lot of space. So if you're a person that you feel like your urination is not coming out like a fire hose, but coming out like a drip, 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 after this type of surgery, you should be peeing like you're a teenager again if you got a good surgery. Next slide, please. And we've done all sorts of stuff to try to innovate in this space using ultrasound to help make it safer and more learnable and practical. Next slide, please. But I'll just go through that very quickly. Next slide. Next slide. And so let's talk a little bit about women's side of the bladder health issue and just get you a couple of takeaway points to take home to your health too. Next slide, please. So when it comes down to women's bladder health, there's probably two things that weigh the most heavily on us. It's recurrent urinary tract infections and discomfort, and it is incontinence. So one thing that people don't recognize is that there's a lot of stuff you can do that's not medications and that's not surgery before you get to those things to improve your bladder health in women's urology. I'm listing you here cranberry supplements, probiotics, good hydration. What I mean by that is you should drink enough to pee 2 liters a day, and if you're not, you should drink more. Hygiene and then vaginal estrogen cream. Those are kind of the things that we think of as all the pre-medication, behavioral, and supplement changes that are good. Next slide, please. And then when it comes down to incontinence, that was a urinary tract infection kind of take home. When it comes down to incontinence, you need to work with your urologist to try to figure out why you have incontinence. In general, there's 2 types. One, the most common that we kind of think about as adults is that the muscles get weak. It's associated with, having lots of kids from vaginal birth and delivery. And then you cough or sneeze, or you go to yoga, or you do an exercise and urine comes out. That's from weak muscles. That's stress incontinence. But there's another type of incontinence, which is that your bladder squeezes when it's not supposed to, and that's called urge incontinence. So working with your doctor to figure out which of those it is will help you to see, are there non-surgical options? So pessaries are a device that you can put inside the vagina to help you not leak. Pelvic floor therapy, I can't emphasize enough how helpful that is for many people. It's underused. Acupuncture is used with a little bit of electrical stimulation nowadays, and actually a lot of that came out of UCSF from a technology standpoint. And I'll point this one out too, is that a lot of these things that you could only get in a doctor's office before are now becoming that you can actually go to Walmart or Walgreens or Target or CVS and buy them off the shelf. And this particular company called Live Labs, I finished my MBA through the Wharton program last year, and a classmate of mine actually designed a device, went through a very similar experience that Dr. Huang just traced out, and they're now putting pessaries on the shelf in front of people, and they're almost to market soon. So a lot of things you can find before you even get to the doctor's office that are available to patients now that weren't before. Next slide, please. Surgery is still a mainstay for stress incontinence for women. That would be my main take home, because in the last 15 years, what I'm showing you here is that, here's the bladder, here's the front of the abdomen, here's the bladder, here's the uterus. We put these mesh slings in that go around the urethra. So they pull on the urethra to get you a little bit more tightness on the urethra so that you don't leak. This is all synthetic mesh material, and there were a bunch of lawsuits that went around because people said the mesh is causing problems and erosions and infections. So a lot of companies actually stopped making slings. If you've Googled anything and thought, I don't want to have a surgery because I don't want a sling, it is still probably the most effective and safe surgery for women's incontinence. So that's the main take home here. It got a lot of bad press, but we still use them very often. So if your doctor is offering you a sling, it's not because they're a bad human being, it's because they're paying attention. Next slide, please. So that's kind of a bullet points of the summaries of the actual talk here. One, I hope that you've taken away that I believe, and hopefully all of you believe, that quality of life is very important. And a lot of things we talked about for bladder health are not scary, they're about improving your quality of life. If you treat your bladder with care and respect, so if your bladder says go pee, and if your bladder says sleep the night, that will do the best for you in the long term. You'll realize that urologists, we never talk about urologists because they're funny people that make a lot of dirty jokes, so we just don't talk to them, but they can someday be your best friend if you need them. And have that sophisticated conversation when you do meet with them, because you know that they have a lot of tools, medications, pelvic floor therapy, multiple surgeries, and if you're not getting that from your urologist, but just a bunch of jokes, you should probably find another urologist. And with that, you know, there are a lot of different options to preserve the quality of life when it comes to your urinary bladder. So I'm going to go to the last slide for a moment and just introduce you to the UCSF team here. So I've had a senior partner that recruited me here. That's the hospital where Dr. Shen was actually at many years ago, although they've moved this to a whole new women's hospital now across town. And that's all my contact information. So if you live in the Bay Area or you pass through or you come here often, there's plenty of urologists here to go around. But I want to turn my last 2 minutes to talk about the thing that I started off with, which is that one of the most amazing things to me growing up as a child of your community is that the TIDOC community is amazing. I mean, the fact that you connect so well and so deeply over many years across many geographies, to me, has been remarkable. Next slide, please. I've been at UCSF for a really long time, mostly because Dr. Shen told me you should go to UCSF, and that's how I ended up there. And his son, Wen Shen, has been a big role model and mentor of mine. I've recently been tapped to move to Alabama, so I'm actually going to go there to chair the Department of Urology there. So your excellence is kind of passing on to next generations. Next slide, please. And the first question Mom and Dad asked is, where's Alabama? We just moved here. Why are you going and where is that? And I think Dad, this just happened like 2 weeks ago, and Dad's been saying Arizona the whole time. So in fact, here we are in California. Alabama is right down here in the deep south. I never would have thought I'd be saying this on the stage that I'm moving to Alabama. And Birmingham is here right in the middle of the state. And next slide, please. I have been blown away by how wonderful the community there is. And as I was preparing for this talk and trying not to scare you all with the urology things, it struck me that one of the most amazing things about the TIDOC community is the people. And that's been a big motivating factor for me. So your values have been passed down certainly to me, and I think many people, and your children, I imagine, are the same. Those values have been passed on. So the people are wonderful. Next slide, please. So I would offer this up as just a thought, is that I've heard about these wonderful communications, Dr. Huang and others here. Eddie Chang is a good friend of mine. I mean, they're doing amazing things. So that partnership is great. Cross-collaboration allows us to do amazing things. And being a part of this community, I feel very honored, and I feel very lucky to be a part of it. I went to go visit TIDA back in 2016-17. I couldn't find the picture when I was preparing this talk, but I stood right in front of those columns, and I was like, where do these palm trees come from? I can't believe they're here. And it's an amazing place, and surrounded by amazing people. And so hopefully those memories also bring you back to there. This is University of Alabama's hospital, and while it doesn't have any palm trees, I hope that this is also an opportunity for us, Dr. Huang, others in this room, to engage in furthering this community and bringing people together, figuring out how to form fellowships and exchange. That would be a wonderful, wonderful outcome. So thank you so much. Last slide, please. And I'll just leave you with this one thought. And I was told many years ago, if you want to go alone, go. If you want to go fast, go alone. If you want to go together, go far. And that's what this community feels like to me. So thank you again. Thank you so much, Dr. Shen. I really appreciate you all. Thank you.